Hello, and thank you for joining us for this webinar, Beyond the Diagnosis, Nurturing Your Mental, Physical, and Emotional Well-Being Through Prostate Cancer. My name is Jeremy Patch, Senior Director of Patient Programs and Education here at Zero Prostate Cancer, and I'll be serving as your host. I'm excited for you to hear from our featured speakers, Ezekiel Cooperman and Dina Mendoza, shortly. As oncology social workers, they're well equipped to lead us in an honest conversation about the challenges of living with prostate cancer. I'd like to share just a few notes before we get started. Today's webinar is being recorded and will be posted on our website, zerocancer.org, later this week. Closed captioning is available at the bottom of the Zoom window. Look for the two C's in a box and select Show Captions. As soon as the event ends, you'll see a link to a survey. We want to hear your feedback on this event and topics you'd like to have covered in the future. Tomorrow, you'll also receive an email with a link to the recording location and the survey. And please drop your questions in the Q&A feature, and we'll do our best to get to as many of these questions as possible after the presentation. Remember, neither Zero nor our guest experts can provide individual medical advice, so please keep your questions general. I'd first like to thank our webinar series sponsors, Boston Scientific and Foundation Medicine. I'd also like to thank Baptist Health for their support of this webinar. Their generous support makes events like this possible, so thank you to our sponsors. Zero Prostate Cancer is on a mission to improve and save lives from prostate cancer through advocacy, education, awareness, and support. Our vision is a future where prostate cancer detection is early, support is unwavering, and care is accessible to all. And some of the ways we do this is through our programming. We are proud to offer a variety of free prostate cancer support programs and educational tools. If you or someone you know needs resources at any time while facing prostate cancer, please share these tools. These programs offer relief and a chance to connect with others who are experiencing many of the same things you are as a patient, survivor, or caregiver. 0360 provides case management to help patients and their families navigate insurance and connect with financial assistance and emotional support programs. Just call 1-844-0360. You don't have to face prostate cancer alone. Whether you're a caregiver or a patient or survivor, we offer two peer support programs. The Mentor program makes one-on-one connections, while our support groups are offered virtually and in person. Get the support you need by talking to others who have had similar experiences. And if you prefer online support, you can connect with others affected by prostate cancer in Zero Connect, which is a private Facebook group, or our prostate cancer forum powered by Inspire. Two different options for you. I want to remind everyone again that this webinar is being recorded and will be available later on our website, zerocancer.org. Now, please join me in welcoming Ezekiel Cooperman and Dina Mendoza. Ezekiel is a licensed clinical social worker with 22 years of experience who currently moderates a men's cancer support group. Dina is also a licensed clinical social worker with 18 years of experience. She supports patients with genitourinary cancers, which includes prostate cancer. Both currently work at the Miami Cancer Institute, part of Baptist Health. Thank you both for being here, and it's my pleasure to turn it over to you.
Good afternoon, everyone. Thank you for joining us. On behalf of Zero Prostate and the Miami Cancer Institute, I'd like to welcome you to this presentation. My name is Dina Mendoza.
And I'm Ezekiel Cooperman.
Sorry, having a little trouble moving on to the next slide. Today's presentation agenda, we're going to be speaking about treatment side effects and coping, mental health impacts of cancer, emotional well-being strategies, and some tips for coping with stressors during the holidays. We'll speak about support systems and lastly, speak about some community resources available. So some common treatments for prostate cancer. They range from targeted therapies to surgical options and active monitoring. We have radiation therapy, which is usually performed to the targeted area, androgen deprivation therapy or ADT, which suppresses hormones, chemotherapy, which is a systemic cancer treatment, surgical prostate removal, and the goal of this is to remove the cancer, brachytherapy, which are implantable radioactive seeds, active surveillance, and monitor. This is for monitoring of low-risk prostate cancer. And there are also other therapies for advanced prostate cancer, which include radiogland therapy, radiopharmaceuticals, PARP inhibitors, and immunotherapies. Many of these treatments come with significant side effects that impact physical, mental, and emotional. We'll be speaking about more of that.
We'll go ahead and transition now into men and mental health for men who are active in treatment and their wellness. These are some statistics about how cancer affects men in general. It is known that about 1 out of 3 patients treated for cancer in hospitals have a mental health condition or concern. Anywhere between 8 to 24% of people with cancer have also experienced some form of depression. There's also research that indicates that there's a connection between mental health and cancer survivorship. And in one study of U.S. veterans, cancer patients who also received mental health services live longer than those who did not. And the takeaway here, most importantly, is that as a cancer patient, as a gentleman with prostate cancer, to really take a look at the importance of your mental health as well as your prostate health and your cancer care as you proceed on your cancer journey. Next slide, please. We want to talk a little bit about a common phenomenon that exists with a lot of patients who are active in treatment, diagnosed, or being overseen for their prostate health. Distress generally includes intense feelings, possibly of sadness and worry, but also anger and frustration related to their actual diagnosis. It can be defined as any unpleasant experience. It could be mental in your mind, physical in your body. It can affect you socially or spiritually. Distress can affect the way you think, feel, and act. And that's why it's important to talk about it as a cancer patient, prostate cancer. Also, it's known that distress is common among people with cancer, and it's normal to be concerned about the changes in your life. Distress is, in general, a normative process here. Cancer can bring on many challenges, and it affects your body, but may also affect your relationships with work, finances, and your interpersonal relationships with others. The challenges are harder if distress is causing problems as well. And this can affect someone's own personal life, their social life, their mood, their faith, and other aspects of their health. Next slide, please. And now that we have a bit of an understanding of a diagnosis, and we'll talk a little bit about how we would move forward here. Emotions in cancer are important. These are always feelings that are normal to patients, and it can affect your physical health as well as your emotional health. As we had mentioned earlier, it makes the feelings more intense many times, and these can change from moment to moment, day to day. So this is true whenever someone's in treatment, finished with treatment, or even for family members and friends that are surrounding them. So again, a normative process. And a lot of times how men and patients move forward has a lot to do with how they normally would cope, right? So just to give you some examples here on the bullet points, some male patients have a difficulty with coping because they feel that they need to be strong to protect their family or they're primary breadwinners. Others may use their support system or turn to loved ones or other cancer survivors. Some may ask for help from counselors and other professionals, and some may turn to their faith also for coping. Whatever it is that you decide as a cancer patient, I think it's important to do what's right for you and try not to compare yourself to other patients with even your similar diagnosis of prostate cancer. We encourage you to turn to your family and friends and share some of those feelings if you're comfortable doing so. And if not, we'll provide you with other information and resources of where to seek out additional help. Next slide, please. This is a slide about age and stage of diagnosis, as well as mental health and motivation. So why is this important? Abraham Maslow has a hierarchy of needs for all of us in general, in our survival mode and throughout the stages of our life. Many times, men specifically identify themselves a lot with their independence and autonomy, with their work, with their family, and what kind of legacy they may be leaving behind. So, as licensed clinical social workers, wherever you are seeking care for your prostate cancer, a lot of cancer centers it's important for us to know about where you are in your life, what stages of your life that you're in, so we can tailor the additional support and assistance to provide for you. Next slide, please. For all of us, but men specifically with prostate cancer, there's what we many times discuss as protective and risk factors. And these are some important things to know about yourself and things that perhaps when you're speaking to someone from a support services team may not mention to you, but it's important for you as a patient to know because you can use these tools yourself too to enhance or improve your overall outlook. Protective factors would refer to any characteristic or condition or behavior that would lessen a risk for a negative outcome for you as a patient, and it helps us cope. So essentially, it protects us the way the umbrella would protect us from the rain. They play a crucial role in promoting mental health, and they would serve as a buffer from any events in our environment, perhaps that we're not able to control, such as a diagnosis of prostate cancer. On the other hand, risk factors are sometimes conditions or characteristics, or even behaviors that sometimes may play a negative outcome or have an adverse effect if you're dealing with also a health condition. They play a significant role in the development of putting gentlemen at risk for mental health disorders. So it's important to identify and know what some of these factors are, and then which ones of them can be modified and which ones may be more difficult to modify. So it's important to know as a patient what those things are for you. Next slide, please. This is a little bit more of a in-detailed slide on some of the risk and protective factors for men and mental health. If you look on the protective factor side from a psychological perspective, having a reliable support system from other family members and friends, always good. This is following rules at home, school, and work. That just means a home routine, a school routine if you're in school or working. So something that gives you something to look forward to, a distraction. Of course, emotional self-regulation is a little bit about how you manage your normal range of emotions and how those present themselves and how you deal with them, but also any problem-solving skills that a prostate cancer patient may have. And also, of course, your sense of self-sufficiency, and also how optimistic you are or your outlook on life in general. And we'll speak a little bit more about that in the next couple slides. Also, from a social standpoint, some protective factors is your ability to be able to make friends and get along with others. So, an example would be seeking out to the mentorship helpline or the one-on-one helpline through Zero Prostate to get additional assistance or support, establishing and nurturing these relationships, as well as relationships with family, and then also any social activities, sports teams, clubs, or religious organizations or groups that you're part of. These are all activities that give all of our patients, our men with prostate cancer, a sense of belonging. Of course, this is also important in terms of economic stability and financial security, also is a buffer and a protective factor, as well as access to any type of support services. On the other side, risk factors, these could be psychological and social, and these are kind of one and the same and similar, but any stressful life situations, any financial problems or difficulties with the law are sometimes factors that make being a patient on top of the stressor a little bit of a challenge. As well, also, of course, any difficult life experience, having had served in the Army or armed forces, or any violence or anything that you've experienced like that may also be a challenge. And this, of course, may also is challenging because it may affect how one feels, how they perceive that they can resolve problems, and their out in general outlook on life. Also, believe it or not, sometimes a level of education or your level of understanding also can be a risk factor in terms of understanding the plan of care and recommendations from your prostate health team or your clinic team. Next slide, please. There's a physical and emotional challenges for men in all stages of their cancer journey. So we've talked a little bit about some of these things, but I think it's interesting to note. Specifically, I'll start with the physical challenges that some of these may be side effects of actual treatment or the medications that you're taking, but also these can also be masked and end up being also things that may put someone at risk for depression or anxiety. So, for example, sleep could come from treatment side effects, but it also could be excessive worry about some of those stressors that I had touched upon earlier, fatigue and low energy levels. So it's important to know if these physical challenges are a normative process for you based on your treatment and your treatment plan with your doctor. Um, and then, of course, also there's the distress related to body images, changes in any appetite you may have. If you're having any urinary incontinence or changes in that related to your prostate cancer care. And then also sometimes many patients that we see and we follow sometimes have difficulties with memory and concentration. And then, of course, lastly, because of where the prostate anatomically is located in the male biology, any difficulties with intimacy and sexual dysfunction also may have an impact. And then again, of course, on the emotional challenges, these are some normative things that sometimes our patients express to us, whether they're feeling fearful and worried about the future, overwhelmed with the medical information, distress we discussed, any loss of sense of control, anger and sadness, feelings of loneliness, or that they did something wrong, and also what to expect of treatment. And of course, there's also fear of recurrence and a feeling that things won't get better or no one can help you with the situation. So I think the takeaway here is that there's a lot of challenges for patients, for prostate cancer patients, but there's also a lot of hope and a lot of assistance and support that's built into cancer care for prostate health. Next slide, please. So how do we address some of these challenges? So the National Coalition for Cancer Survivorship does have an excellent website with additional information on survivorship. It's a survivorship checklist that many times can be accessed for patients, and they can take a look and do a check-in, I guess, on how they're doing. So, for example, they may be able to discuss any emotional, it'll give you a list of things you can discuss. For example, any emotional or psychological concerns that you may have, and then speaking to somebody about that. So, if you go to your oncologist, possibly talking to them about where to seek support for counseling for any of the concerns that they may have in those areas. Also, identifying a support group that is available in order to meet like-minded individuals who are also walking on the same path or have experienced prostate cancer or the side effects of prostate cancer treatment, and also just to stay connected with other survivors. With the physical challenges, obviously, it's also important to be able to really know and understand what your plan of care is, what treatment you're going to have or that you've already had. I think that helps all of us feel a bit of a sense of control and understanding. But also it's important to know, so then that way, as you've recovered from treatment, you can, if you still have any questions or concerns from a physical or an emotional standpoint, that you're able to address them with your healthcare provider. Of course, also there are some short and long-term treatment side effects, and it's important to understand what the treatment plan you had was, so that way you can bring those up if you're having any concerns related to that. Also, of course, understanding that it's important to continue to get screened at preventative health, but also to prevent recurrence of any new cancers. And then lastly, just a well-balanced diet, exercise, and other healthcare recommendations that we'll go into as well that help us feel better about our overall health and our outlook. Next slide, please. We'll talk a little bit about the 5 stages of grief. Elizabeth Kubler-Ross has a model for grief. Many people possibly have heard about some of these stages. So we'll try to go through them briefly. Of course, we like the slide because it goes in a nice order from denial, angle, bargaining, depression, and acceptance. But the truth of the matter is, the takeaway of the slide is that there's a very similar process in a cancer diagnosis or a diagnosis of prostate cancer of grief. And there's no right or wrong way to grieve. And even though this goes in order, there are some patients that never go through these stages. There may be other men that go through them in out of order. So they may be depressed first, and then possibly anger, and then later have denial. So there's no right or wrong way to grieve. It's the experience of coping with loss that can accompany any event that disrupts or challenges our sense of normalcy or ourselves. And this includes loss of connections that define us as who we are as men. Next slide, please. So the first one from the stages is difficulty accepting the reality of loss. Whether you're first diagnosed, it's the belief that you can't believe that you have cancer, or not wanting to speak about cancer, or like as many men many times do, dive themselves into their work and overwork themselves simply just to be able to not think about their feelings or have time to process what they've been experiencing. Next slide, please. The second stage here is generally anger, and this is usually a normative response to a cancer diagnosis, which can be manifested as fear, helplessness, anxiety after a diagnosis. And this is if you've ever spoken to anyone with prostate cancer or any caregivers. There is important information about, when you hear someone ask about the why me questions. Next slide, please. Bargaining being the third stage is generally a reaction of thoughts of after you're feeling, a feeling of difficulty or helplessness. It's usually characterized by attempts of reversing or lessening the reality of a situation. So these would be the if only statements. If I would have seen a doctor sooner, or would I would have listened to my body sooner. Those kinds of things are generally related to the bargaining stage. Next slide, please. Of course, within the 5 stages is also depression, which can be an intense feeling of sadness or grief. It's a very common for many men to have depression or mental distress as your plans become uncertain. So this is kind of an area where also you may hear men, for example, say, I've worked all my life, saved for retirement, only to get sick, and I can't enjoy retirement. How am I going to take care of my spouse? Who's going to take care of me in the future? Those kinds of things. Next slide. And lastly, this is a slide about acceptance and learning to live with a diagnosis, or allowing a new reality to be included, a new reality which includes some joy and sadness in parallel frames of reference. Now, I think it's important to note that acceptance doesn't mean that necessarily, it's still difficult. It's still a difficult phenomenon and ideal, but you learned how to kind of circumnavigate or move around it in order to be able to assist and get past that challenge and still enjoy a quality of life in other areas, perhaps. Next slide, please. This is a nice slide on grief, and it says that grief is like the ocean. It comes in waves, ebbing and flowing, and sometimes the water is calm and sometimes it's overwhelming, and all we can do is learn to swim. So this is about adaptability and resilience for our men with prostate cancer. Next slide, please.
We'll be speaking now about,
Actually, I'm sorry, I'll do this one. Sorry about that. There is one slide over here about locus of control, which I think is another phenomenon, which is kind of like a psychological term, but I like to talk to patients about this in general to our folks, because there's generally a theme with all of us within us that we have an internal locus of control where we have this perception that we have control over the outcome of our lives, right? So this would be on the left saying, I can determine my future. Look what I can do. I make things happen. So you make things happen. So that's having a sense of eternal locus of control. Why is this important to know about yourself? Because this usual locus of control will also help you when you have a diagnosis and how you have to move and adapt to the new normal for you. The opposite is also true. Someone with a locus of control that is kind of external usually carries a theme or an idea or a mindset at times that they don't have control over their future, that all these things happen to me, and that doesn't make sense to fight the fight. Let's say, for example, why bother because all the bad things happen to me. So this is kind of an interesting um, side of a patient experience that sometimes it is good to know as a patient.
Now we're going to be speaking about what is within your control as a prostate cancer patient. We're going to be speaking about the 6 pillars of lifestyle medicine. First one is optimal nutrition. So poor overall diet quality is the leading cause of premature death in America. Optimal nutrition is necessary to the root cause treatment of chronic conditions. The American College of Lifestyle Medicine recommends an eating pattern based predominantly on a variety of minimally processed vegetables, fruits, whole grains, legumes, nuts, and seeds. So pretty much like whole foods. They also recommend physical activity, which is essential to offset a sedentary lifestyle. It helps to manage chronic conditions, and it helps support overall health. Adults should aim for at least 150 minutes of moderate activity per week to help prevent issues like osteoporosis and cardiovascular disease. They also recommend restorative sleep, which is very, very important to just healing in general. Unhealthy sleep is associated with the most common causes of premature death and disability, and it can lead to an increased risk of impaired memory, dementia, and cardiovascular disease. Quality sleep powerfully supports chronic disease treatment and overall well-being. We should all strive to create the right conditions to get at least 7 to 9 hours of quality sleep every night to allow the body to rest and repair. And that's something we also help here at MPI. We help our patients create with sleep hygiene. We provide a lot of education on sleep hygiene here. Something else that's within our control, stress management. Chronic stress can exacerbate health issues like cardiovascular disease, depression, insulin resistance, and many others. Stress management strategies are crucial for overall health as well as in the treatment of chronic disease. Connectedness, meaningful interactions are a key factor in human happiness, longevity, and the treatment of chronic diseases. Strong social connections, as well as having a sense of purpose and meaning, affect physical, mental, and emotional health, and can even reduce the risk of depression and dementia. Also, risky substance avoidance. So things like alcohol, tobacco, and other drugs dramatically increase the risk of death and chronic disease, and they exacerbate the effects of the disease. Other risky behaviors and exposures can negatively impact mental and physical health. Addressing these behaviors with evidence-based approaches is an essential element of health restoration. So we're going to speak about some tips on managing mental health. First, start with self-screening, taking an online mental health screening exam. You can just Google something like Mental Health America's mental health test. And it's a way of kind of reflecting on one's feelings before talking to the healthcare professional or mental health care specialist, just to see where you are when it comes to mental health. Once you do that, definitely speak to a professional. You can speak to a social worker, a psychiatrist, a psychologist, or even a physician, so that they can refer you to a counselor or other support services. Ask for help. Family members and friends, they can be a great support system, and cancer patients are encouraged to ask for help when they need it. Join a support group. Talking to others who have had similar experiences can be very therapeutic. It can be very helpful. It can help you not feel alone in your journey. Cancer patients and survivors may be able to find in-person and virtual support groups through hospitals, as well as local chapters of cancer support organizations like Zero Prostate. The National Cancer Institute also offers an online directory and support services for cancer patients. Another tip is living in the present and finding ways to feel grounded and focus on the present. Sometimes we can get lost on the what ifs, and I wish I had changed this, or if there's something I could change in the past to avoid being where I am. But it kind of blurs the ability to be able to live in the present and just take things day by day and focus of your treatment and what's happening in the moment. Also, prayer and spiritual practices are helpful for some cancer patients. That includes meditation and mindfulness exercise. Also, keep a journal. It can be hard to remember feelings from a week ago or a month ago. So let tracking one's emotions on a daily basis, it can serve as a reminder to reflect on how they're feeling and aid in monitoring symptoms of mental health issues. Also, making time for exercise. Like I mentioned, exercise is very, very useful, and it's been proven to help lower stress, and it's very helpful also with lowering just stress levels, helping sleep. It has a lot of good benefits, and it definitely plays a helpful role in managing mental health. So even light walking can help with feelings of anxiety and depression. Some self-help tips for men to process their feelings and resilience during the cancer journey. Number one, connect with other men who understand what you're going through. So the beautiful thing about men's support groups is that it allows men to normalize their feelings and break the men code that men don't share their feelings. So support groups allow men to deal with their emotions and receive support in a healthy way. Number two, jot down your feelings on a piece of paper for 5 minutes. For example, you can write down, I'm really mad today, or I'm fearful about this. And then once you're done, look at the paper and rip it up. So you get to express your feelings in a safe way, and then you can use your masculine energy to do something about it by ripping up the paper. Number three, sit quietly for 5 minutes and take deep breaths. So whatever emotions come up as you're sitting there, just let yourself feel them. And if you're angry, allow yourself to feel angry. And soon enough, the emotions pass through and you can move on to another feeling. So this is another way to kind of ground yourself and feel the emotions that you're feeling in the moment and then move on. Number four, talk to someone. You don't have to give a speech to the entire family. Just talk to someone close to you and let off a little steam. So you don't compromise your health. This is just venting. Just venting to someone can definitely help you manage those emotions that you're feeling. Seeking professional help through evidence-based interventions. This could be done, like we mentioned before. You can go to a psychiatrist, psychologist, licensed clinical social worker, licensed mental health counselors, or licensed marriage and family therapists. So one of the therapeutic interventions that are offered to patients is cognitive behavioral therapy. This is an evidence-based intervention coined by Aaron Beck in 1960. The key principle is that through patterns, its thought patterns affect emotions, which in turn affect behaviors. These are 40 to 60-minute sessions, one time a week. And they usually last about 12 to 12 weeks in duration. Effective for several disorders like mood, addiction, phobias, eating disorders, and chronic pain. Number two, therapeutic intervention, acceptance and commitment therapy, or ACT, excuse me. It was coined by psychologist Stephen Hayes in 1994. It's a contextual approach to treatment. It comes from the behavioral school of therapy. It usually happens in 40 to 60-minute sessions for about 8 to 16 sessions. The key point of this is that a more fulfilled life can be attained by overcoming negative thoughts and feelings. It accepts, so A stands for accepting the effects of life's hardships. C stands for choosing directional values like kindness, connection, growth, being helpful. And T stands for taking action. Number 3 is dignity therapy. It was developed by a psychiatrist, Harvey Shoshana. The key point is to relieve psychological and existential distress in patients at the end of life. The treatment consists of creating a narrative of meaning for patients. So it addresses end-of-life concerns like the need of generativity and autonomy and control, and that's supported by this form of treatment. The need for care that is empathetic, unconditionally positive, genuine, and attentive. And the need for continuity of self, maintenance of pride, hopefulness, growth preservation, and addressing aftermath. Something else that's very used very often is breath work and guided imagery. So it's the breath is just to call Thich Nhat Hanh. The breath is the bridge between the body and the mind. So these types of breath work are intended to relieve stress and reset mind and body after a stressful situation. So we're training our bodies to kind of breathe through moments of stress and moments of anxiety. So it includes box breathing, diaphragmatic breathing, nurse-led breathing, 4, 7, and 8 breathing, alternate nostril breathing. There's also guided imagery. These are mental images to stimulate the sensory perception of all 5 senses that may precipitate strong emotions or feelings. So we're going to speak about holidays. Holidays, for the most part, are very happy, happy time of the year. But for a lot of patients, it does bring a lot of fears and emotions, especially if you're somebody that's going through a cancer diagnosis. And why is this? So we have increased emotional expectations. We have social comparisons and financial strain during this time of year. Disruptions to medical routines. A lot of cancer centers are closed, or hours are different. Maybe the doctors are out of town and they're not easily accessible. There's reduced access to regular support services. And there's grief and loss triggered by tradition. So maybe a family member passed away during this time, and now every year we're kind of reminded and we're grieving that loss all over again. Some common warning signs during this high-risk period of the holidays: expressing hopelessness or feeling like a burden, withdrawal from family, friends, or activities, major changes in mood, sleep, or appetite, and increased alcohol or substance abuse. How to support someone? Start a gentle, non-judgmental conversation. Listen without trying to fix everything. Just listening without giving any suggestions or opinions. Sometimes that alone is helpful. Encourage reaching out to mental health professionals. Help connect them with supportive friends and family. If you or someone else is in immediate distress, definitely contact local emergency services, 911 or 988 if you feel like someone is at risk for their own safety or someone else's safety. And also reach out to a trusted healthcare provider, not established, and establish care with a healthcare provider right away. So managing mental health during the holidays. Make plans to get together with friends, family, or coworkers. Create a new holiday tradition that makes the most of your energy. Enjoy special moments. Talk to your healthcare team about upcoming special events. Express your feelings in ways that help you receive the support of the important people in your life. Celebrate the strengths you and your loved ones have developed, and be an innovative shopper or gift giver. Remember, your energy It's going to be used this a little differently this time of year. So definitely just take care of yourself and not don't try to go beyond what you're able to do. So some advice for our loved ones: talk on their terms. So this is something for caregivers. Talk on their terms. Be sensitive to your loved one's feelings and encourage, but do not force them to talk about you and other family members and friends about their cancer diagnosis. Always listen. It's important to just be there for somebody that's going through a cancer diagnosis, and fight the urge to deny or discount any negative feelings or share. Healthcare provider, spouses and family members who interact with their loved ones' healthcare team can be proactive in asking for information about cancer and mental health. Join in on physical activity, just going on a walk with your loved one, that can benefit both of you as they go through the cancer treatment process. Respect boundaries. Unless you ask for input, it's often best to not push a cancer patient on medical advice or treatment options they're not interested in. Honor their autonomy and provide them with the support they ask for. And lastly, practice self-care, and that's for everyone, for the patients, for the caregivers. Sometimes caretakers forget to take care of themselves. So it's important for loved ones to take time for themselves, stay engaged in activities, and be in tune and honest about their emotions. Avoiding emotional burnout makes it easier to take care of the people you love. And something that I always tell my patients, when we go on a plane, the first thing we hear is if you need to use a mask, use it yourself first and then help others. So it's the same here. You have to take care of yourself so that you can help others with more energy and more resilience. These are some community resources. Zero Prostate Cancer. You can go on the 0360 helpline, which is 1-844-0360. The American Cancer Society support line, which is 1-800-227-2345. And some others that you can always look up once we share the PowerPoint. Definitely 988, which is a national suicide hotline if you or others you know are having suicidal thoughts. Here are some references for our slides today. And this is a very nice quote that I think it brings a lot of positive and it brings a lot of hope. It is often the darkest skies that we see the brightest stars. So this is how we would like to end our presentation today. And we wish everyone happy holidays, and we'll be opening it for questions.
Thank you both for an informative presentation, a lot of good resources and tips there. Thank you. While we just want to open it up again, if to the audience, to attendees, you can enter your questions in the Q&A box. To get us started, I think one question people often have is the services of an oncology social worker or perhaps a therapist, are those covered by insurance? Oh, Zeke, you're muted.
There you go. So, for example, in Miami Cancer Institute, once you're a patient, our services for this licensed clinical social workers, they're part of the service you receive. Um, for psychiatrists, psychologists, yes, those usually will go through insurance. But there are licensed clinical social workers in the community that are also part of certain health plans. So yes, for the most part, health plans do cover psychology, psychiatry, and licensed clinical social work services.
Great, thank you. And how does one, if someone's at maybe a community clinic, smaller rural hospital, do you have tips for how they can access some of these services that maybe, maybe there's limited social workers available at places like those? Do you have tips for those folks on how they can access support services when they need them?
Yeah, it's a great question. I know that this is obviously a national presentation, so some of us may be living in larger cities, but others may be living in smaller communities or smaller community hospitals. So the best thing to do is try to ask your oncologist if they have anybody that they can refer you to. It may also be a good idea to check with your insurance provider and seeing, so you can call if you have insurance, call your insurance provider on the back of your card, and you should be able to see if they can get you a list of mental health providers that are in network with your insurance plan. If for some reason you don't have insurance, for example, and we can only speak for Florida, but generally speaking, there should be and I know that there's a lot of states that have a general community resources, like an outpatient community resource clinic or health clinic, but also an outpatient mental health clinic. So this would be an outpatient mental health clinic where they can provide emotional support, counseling, sometimes psychiatry for medication management, and those kinds of resources. A lot of the references that are on our presentation here may also have additional assistance and support. So in other words, if you look at Cancer and Mental Health America, though that website, for example, is a website where you can go in, and even if you're not sure what you're feeling, it'll ask you a list of questions, and it'll come up with, based on your answers, a score or maybe a recommendation. That may be sometimes reading or speaking to a doctor or those kinds of things as well. Yes. So I don't know if that answered the question. Another out of the box idea would be that I sometimes recommend to patients, if you have a good relationship with your primary care doctor, if you have a primary care physician, not even necessarily your oncologist, sometimes a primary care physician may also have someone that they refer their patients to who are maybe perhaps are experiencing some distress or they wanted to speak to somebody. So I hope that answers that question.
Yeah, that's helpful. I think asking for a referral from a primary care doc is a good option as well. Thank you for that. We had asked for, we're showing the references here. Someone had asked for that, so thank you. Next question, are the licensed clinical social workers and other support services covered by Original Medicare?
Um, that's a good question to ask, but I think the best thing to do is I think you'd have to probably call Medicare specifically to get that answered. And the reason why is this: Dina and I are licensed in Florida as licensed clinical social workers. I know that I've seen through general insurance panels, commercial insurance, non-Medicare, licensed clinical social workers that are covered. Um, but I don't know with Medicare specifically. Now, on the Medicare website, or even if you don't have, for example, AARP, you can search for providers, and you can search for providers based on what specialty they are. In other words, psychiatrist or psychology, and they can also sometimes provide you with a list. So it's difficult for us to be able to tell you if in the state which you're living, Medicare is covered for license for LCSWs. I know, at least in my experience, Dina, I don't know if you wanted to chime in, that generally LCSWs would be on insurance provider and they're a credentialed provider with a specific insurance, but not through regular Medicare that I know of.
You're muted, Dina. Sorry.
Thank you for that. For some private practice licensed clinical social workers that do accept insurance, If you're looking for someone like that, there's a website I always give my patients, it's psychologytoday.com. And you can look for, if you know, you can filter by your specific insurance, and they'll give you a list of a lot of providers, licensed clinical social workers, psychologists, licensed mental health professionals that do accept Medicare in certain states. And that's a national website. So that's definitely one way to kind of verify that the licensed clinical social worker that you're looking for is accepting insurance, because not all of us do.
Okay. Thank you. Appreciate that. And someone actually entered in a tip. So they say you can look on the Psychology Today website to find therapists, including social workers, psychologists, and psychiatrists. So that's Psychology Today. Sorry, psychologytoday.com. And then next question is, what is the role of medications for anxiety or depression? Should therapy like cognitive behavioral therapy be used without medications?
Mhm. It's a very good question with a complicated answer, but I'll try to. So what you're asking is, is the person at, can you repeat the question one more time?
Certainly. What is the role of medications for anxiety? What is the role of medications for anxiety or depression? Should therapy like cognitive behavioral therapy or other therapies be used without medications?
Yeah. So I think it's very individualized. I think it depends on the symptoms that the person is experiencing. So, for example, someone can have anxiety for a long time and not even have ever had realized it, and then all of a sudden, with a diagnosis of prostate cancer and being in treatment, they're starting to experience panic attacks. So that went from a generalized anxiety that perhaps you could control with a jog or a walk in the park with your dog, to something where you're actually getting in your car and you're going somewhere and you're having, for example, a panic attack, or you can't get to the doctor's office because the last time you had an MRI, you had a panic attack. So there's a distinction. What's happening is that there's a level of distress and impairment, or a level that's impairing functioning. So generally, my blanket answer would be speak to a trained mental health professional, whomever's asking. It's a wonderful question. They will be able to kind of let you know. Generally speaking, a licensed psychologist or LCSW or any of the other disciplines should be able to know if these symptoms could be controlled with, for example, relaxation or cognitive behavioral therapy. However, sometimes some of the presenting symptoms may be significant enough that medication helps as an intervention, or you need something a little bit more than just the general recommendations that we have here. So I hope that made sense.
Thank you. And final question, what is the difference between educational background and training, for instance, between an LCSW or licensed clinical social worker and an LMHP? And will you tell us what that is? Because I'm not sure. Which profession has more training in psychology or counseling? Oh, you're muted, Zeke.
Yeah, it's a great question. So, generally speaking, I can say, at least in Florida, that anyone that's a licensed clinical social worker or a licensed marriage and family therapist or a licensed mental health counselor has a master's level degree in that specific modality or specialization. So, and someone said LMHP, so that's a licensed mental health professional. So generally, it's 2 years of general education, but there was also theory on counseling and in managing patients. But then also, all three of those licensed mental health professionals actually do an internship where for 2 years they are seeing patients in a clinical setting, supervised by another licensed clinical social worker or licensed mental health counselor. Or marriage and family therapist that signed off on their hours, and then they sit for a board exam. And that's how you demonstrate competence. I think that it's a great question, but I think the important takeaway, or also what to look for, is when you're seeking out a mental health professional, what they specialize in. So if it's, for example, if they specialize on health-related stress or prolonged stress or chronic health conditions, that may be someone who has an interest in supporting and counseling men who are possibly dealing with a chronic condition or a medical condition that has affected quality of life or has caused anxiety or depression. A psychologist has a doctoral level training, so they have a higher level training than a licensed marriage and family therapist or all the other four credentialed mental health providers that we're speaking of, including Dina and myself. So they're at a doctorate level and they have more years of training to do very similar things, but also a little bit more in depth.
Thank you. I appreciate that response, and thank you really for answering all our questions and for the informative presentation and discussion. So, as we close today's webinar, I want to remind everyone to please fill out our short survey and to look for an email with the recording in case you'd like to share it or listen again. And we're dropping the survey link now in the chat. If everyone can go in the chat box and click on that. Everyone attending, if you can just fill that short survey out, and then you'll have it done, and we really appreciate it. Thank you for joining us for this important discussion, and I hope you have a great afternoon or evening and a restful holiday season. Thank you, and take care. Bye. Thank you, Dina and Zeke.